I'm Phillip Wessinger, orthopedic surgeon with Steadman Hawkins Clinic of the Carolinas. I've been in practice for 18 years here in Greenville. I see my patients primarily in Simpsonville, but I do have an office in Patewood and see some patients there one day a week. I do surgery at both the Hillcrest Hospital and at Patewood, primarily focusing on arthritis work and total joint replacement. I'd never really thought about medicine very much until in college. When I was wrestling, I had a knee injury and had a really good experience with the orthopedic surgeon that dealt with me. It sparked an interest, and at that point, really probably decided to be an orthopedic surgeon before I decided to go to med school, and subsequently pursued it and have been very happy as an orthopedic surgeon ever since. My training consisted of undergraduate degree from Furman University, MD degree from Medical University of South Carolina, orthopedic training at Wake Forest University Medical Center. I subsequently came back and practiced in Simpsonville, South Carolina for 12 years, and then the last 5 to going on 6 years now have been part of Steadman Hawkins Clinic of the Carolinas. In all honesty, one of the best things I've done is go from being a small 4-man group to being in a group that provides as much collegiality and affords the opportunities that we have as Steadman Hawkins Clinic of the Carolinas in providing care and continuing my professional development. Well over 50% of my practice is hip and knee replacement. I still do a fair amount of arthroscopy, but I do less of that and more replacement. I think as I have aged and gotten older, my patients have too, and that's helped to change my practice. But also, my interest in arthritis has become greater as my career has gone on. And so subsequently, that's the bulk of what I do in my practice and the type of surgical procedures that I perform. I think a patient should expect from their surgeon good communication. I think that they need to have someone who's going to help them explore what their problem is and how it interferes with their function and their ability to do things. And they also should have a good idea of what they can expect afterwards and what their goals should be after the surgery as far as things they either can't do now or want to do, and does this surgery have the possibility of restoring those things for them so that those goals are achievable. Being involved in an academic environment, really the onus is on us to be critical of every aspect of patient care that we deliver. And being critical and self-examining all the things that we do leads us to better outcomes and better patient care by definition. What I think makes me unique is I think I spend a lot of time trying to help the patient figure out their problem. And I'm not going to say I'm the only person that does that, but I think having an injury, dealing with an injury that has hindered things that I want to do and can't do, and having been through orthopedic surgery allows me a perspective. And because of that perspective, I think that I focus a lot on helping patients make decisions with me as opposed to telling patients what they need. One of the most rewarding things about being a doctor was having the opportunity to go to Tanzania and do some mission work. In reality, have thought about that and felt compelled to try to go do something like that for quite a long time, but the opportunity finally presented itself, and that was very rewarding, being able to take things that I've learned, things that I know, and help other folks was a very rewarding experience for me. I have a real passion for sort of reading in history, and particularly reading in history as it relates to the church and church history and the Bible and ancient history. I have actually taught classes at my church for over 10 years on a weekly basis with regard to that. Kind of doesn't inform my orthopedics, but it's something that I enjoy and allows me to kind of explore something beside what work is all the time. I also enjoy cycling and staying in shape, basically, and hanging out with my kids and doing stuff with my wife and my family.